Do you know that not all high blood pressure or diagnosis of hypertension is the same? If you do, let me know the types that you know in the comments. In this video, I want you to know that there are different types of hypertension. So what is hypertension? Hypertension is a chronic medical condition characterized by elevated blood pressure, which is persistent. And usually this is related to the increased pressure on the walls of the blood vessels. Hypertension is a silent killer. Yes, it is, because sometimes individuals may not actually have symptoms and they may come up with complications. And sometimes some of these complications may not just be debilitating, may not just affect the individual's quality of life, but may even lead to death. And complications such as stroke, such as heart attack may occur. So if you have a blood pressure less than 120 of systolic and 80 millimeters of mercury of diastolic, you have a normal blood pressure. And that is if it is not lower than 90 millimeters of mercury for systolic and 60 millimeters of mercury for diastolic. So that is normal blood pressure. But if you have elevated levels, you may be having measurements as high as 130 over 90 millimeters of mercury. So if you have anything above that, you may be having hypertension, and you need to see your doctor for a confirmation of this. So let's dive right into the different types of hypertension. First on my list is essential hypertension. Essential hypertension is also probably known as primary hypertension. It is responsible for 90 to 95% of cases of hypertension. And the cause or causes of this type of hypertension are multifactorial. It is multifactorial. This means that genetic factor, family history, age factor, race factor, these are factors that may make an individual to be at risk of developing hypertension. These are known as non-modifiable factors, while other factors are known as modifiable factors. Factors such as diet, being overweight or obese, drinking of alcohol or smoking, high level of salt intake. These are factors that put an individual at risk of developing hypertension. So imagine a 55-year-old man developing elevated blood pressure persistently above 140 over 90, maybe as high as 150 over 100. Such an individual at that age may actually be developing essential hypertension, that is primary hypertension, and normal protocols should be involved in the management of this. Next on my list is secondary hypertension. Sometimes the cause of hypertension may not be identified, and this is common in the young. Sometimes we find out that there are young people developing hypertension, because aging is a risk factor for developing hypertension. However, hypertension in the young may be related to secondary hypertension, and that is because there are organs in the body such as the kidneys, the liver, the endocrine system, hormonal changes that may occur that may predispose or lead to hypertension in the young. So if a young person is being diagnosed with hypertension, necessarily some investigations should be done to investigate for any organ damage or organ that is at risk of damage leading to hypertension. Other causes of secondary hypertension include thyroid dysfunction, use of oral contraceptives, use of steroids. So in such a case, in secondary hypertension, even with medications, there may not be control until the organ affected is identified, or the factor causing the rise in blood pressure is identified and treated appropriately. The third type of hypertension on my list is uncontrolled hypertension. Now, this is hypertension that does not have a control, the blood pressure that does not have a control despite use of medication. This blood pressure is not meeting the target for blood pressure control, and this may be 130 over 90 or 120 over 80, as the case may be. Causes of uncontrolled hypertension, uncontrolled blood pressure include improper combination of medications, poor drug adherence, lack of lifestyle changes such as reduction in sodium salt intake, stopping alcohol, stopping smoking, or reducing stress. Also, inadequate follow-up may be a cause of uncontrolled blood pressure. Next on my list is resistant hypertension. Yes, in resistant hypertension, it's similar to uncontrolled hypertension, but with the fact that blood pressure is not lower than 140/90 despite the use of medications, at least 3 medications, including a diuretic. If you are a non-hypertensive, you will know some of these medications are different medications: amlodipine, furosemide, which is a diuretic. Others include aldactone, spironolactone. If being used with other drugs, yet the individual's blood pressure is not controlled, that is known as resistant hypertension. Resistant hypertension. This may be related to kidney dysfunction and even obesity. Next on my list, let's talk about white coat hypertension. Have you ever been to the doctor's office or in the hospital or clinic and you find out that you have elevated blood pressure, but at home your blood pressure is well controlled? Your blood pressure is within normal range. Or do you know someone that experiences that? That is known as white coat hypertension. And this is usually related to anxiety. Some people just seeing the white coat, whether of the doctor or the nurse, gets them anxious, and anxiety, any form of stress, can make the blood pressure to be elevated. So there is no cause for alarm if you have this experience. However, your blood pressure must be well monitored. And interestingly, some of the things that can be done to be accurate with these measurements include doing a home blood pressure monitoring or doing ambulatory blood pressure monitoring for about 24 hours. This can significantly help to rule out hypertension. Next on my list is maxed hypertension. Yes, maxed hypertension is the opposite of white coat hypertension. This happens when your blood pressure measurement at home is higher than what is being measured in the hospital. Okay, this makes hypertension to often be missed during routine clinical visits because the nurse or doctor assumes that the blood pressure is normal. So until an individual gives that history or information about the blood pressure being high at home and low in the hospital, a diagnosis of maxed hypertension may not be made. The danger here is that hypertension may be missed and damage to different organs can occur, including damage to the kidneys, damage to the brain or the heart can occur. And this can be prevented when proper measurements are taken at home, in the hospital, and a proper evaluation is done by your doctor. So my advice is this: check your blood pressure in the morning, check in the evening, have a recording that you have a date attached or dates attached to them so that you can present to your doctor for proper assessment. And if you have symptoms such as headache, dizziness, fatigue, palpitations, puffiness of the face, swelling of your feet, then you should get to inform your doctor so that appropriate steps can be taken for your management. Next on my list is gestational hypertension. Yes, this is hypertension in pregnancy. Yes, do you know that hypertension can occur in pregnancy? It's possible that a woman has hypertension prior to conception, and that may be described as chronic hypertension. However, some women develop hypertension in pregnancy. There could be pregnancy-induced hypertension, which normally occurs from about 20 weeks gestational age in a woman who had normal blood pressure prior to conception. And the danger of having this kind of high blood pressure is that there may be harm to the baby or even to the mother. The risk of loss of pregnancy, risk of premature labor, the risk to the mother, the risk of preeclampsia and even eclampsia. These are some complications that may occur in a woman and a baby with high blood pressure. So close antenatal monitoring is very important, and proper management by your doctor and following appropriate steps in management and close follow-up is important for both the mother and the baby to avoid these complications. 8 on my list is isolated systolic hypertension. That means the higher readings, the systolic is higher, greater than 140 millimeters of mercury, while the diastolic value is less than 80 millimeters of mercury. This is common in older adults and may be related to stiffening of the arteries, which occurs with aging. And finally, on my list is diastolic hypertension. Diastolic hypertension is the opposite of systolic hypertension in the case where the lower reading is greater than 90 millimeters of mercury, while the higher reading, that's the systolic reading, is less than 140 millimeters of mercury. This is common in young adults. Lifestyle changes may be helpful. However, some people will benefit from use of medications. That's it on this topic. Those are some of the different types of hypertension. You may like to go over them again, play the video to learn these different types so that you can be well informed and relate appropriately with your doctor. However, I will give you these tips before I end this video. 1. Check your blood pressure regularly, at least once a week as an adult and as recommended by your doctor. Use the right blood pressure monitor for your measurements, especially talking about the right cuff size for your arm. Take appropriate steps when it comes to measurement of your blood pressure. You can check out my video on 12 mistakes that people make when measuring blood pressure. And you don't want to make those mistakes to avoid false readings. Reduce salt intake, especially sodium salt, and reduce processed foods, fries. Increase vegetable intake, increase your fruit intake to prevent or even in the management of hypertension. Exercise regularly, at least 30 minutes of brisk walking every day, at least 5 days in a week is recommended. This will help to reduce blood pressure, even if you are a known hypertensive. Remember to keep to your follow-up appointments with your doctor. Be regular with your medications. Follow your doctor's advice, and I'm sure you will enjoy your life, even if you are a known hypertensive or you have a recent diagnosis of hypertension. Finally, there are different types of hypertension. However, it can be controlled. Thank you for watching. See you in the next video. Remember to subscribe if you are coming across this video for the first time. Check out other videos related to this topic, and do well to like if you like what you have watched. Do well to drop a comment, and I'll see you in the next video. Bye for now.